To disinfect a room, you don't want to get your hands dirty. You want to do it quickly. There's a robot for that, and it is called the Xenex. It uses super-powered UV light to kill bacteria and sterilize rooms. And there's one right here in this studio. It may be disinfecting me as we speak.
We hope.
And the CEO of the company...
We can only pray.
That was cruel,
Sorry,
really
Stuart.
cruel.
Sorry.
Let me introduce Morris Miller properly. He is the CEO of Xenex Disinfection Systems, which puts out the actual Xenex itself. Can we put that on camera, please? I want to let everybody see this thing. Now, this is a little robot.
This is a demo robot. So this one isn't actually doing the disinfection. If it did, you wouldn't want to be in the room.
Really? Okay. Oh, you don't want to be in the room?
You don't want to be in the room with it. You want to let it hit all of the surfaces in the room, and basically in 5 minutes it will eliminate all of the pathogens in that hospital room so that the next patient doesn't get the infection that the previous patient had.
Now I can see it's like a trolley on wheels. Yeah. You wheel this thing into the center of a hospital room. Do you have to do anything else? You have to put a little... I mean, how do you... Just sit it in the middle of the room and it works?
So the housekeepers become the heroes of the hospital. Literally, they put it on the left side of the bed, they run it for 5 minutes, then they flip the remote control, the nurse's handset, the telephone call button, flip everything, flip the mattress, do it on the right side of the room, and all of a sudden the room is disinfected. These rooms have always looked, sparkling clean. They've done a great job, but there's superbugs on all of the surfaces of these hospitals. And the question has been, well, if you disinfect it and get rid of the superbugs, will the infection rates drop? And over the last 3 years, we now have the gold standard is outcome studies. Yep. We have 7 outcome studies that show in hospitals, UCLA, Stanford, top hospitals in the country, we're in 300. 50% to 100% drops in infection rate with a return to the hospital.
How much is one of these machines?
So the machine costs about $100,000, $3 a room. From the hospital's perspective, it pays for itself in about 3 months.
Hold on, you can do 30 rooms in a day.
30 rooms a day with one robot.
Wheel it in, turn it on, walk out.
Walk out.
Is it like a big burst of sunlight in the room?
Yeah,
what is it?
It's 400 to 1,400 times more intense than like a fluorescent light bulb. It can be as much as 25,000 times as intense. It would not blind you, but you don't want to. You still don't, right? You don't want to look at it. Not for very long. For a short exposure, it doesn't. I've looked at it and I'm still okay.
How many hospitals have bought it?
So 300 hospitals around the country.
Done it already.
Absolutely.
And you've disinfected how many rooms?
Over the last 2.5 years, we've disinfected about 4 million rooms.
Wow.
No incidences of
total success rate.
Yeah. Okay. It can't not work.
May I remind everyone that Morris Miller is the chief executive of Xenex, and you are a serial entrepreneur. You created Rackspace, didn't you?
With some founders' help, just like this company.
You founded it.
Absolutely.
And now the same thing again with Xenex.
Yeah, the difference is, in this case, we know for a fact that we can help prevent 70,000 to 100,000 deaths. All of us are at the age where we're going to have our knees, hips, backs worked on, replaced.
Tell me.
It is not worth the risk to get an infection when for basically $3, you can tell the doctor, stop the risk.
How much of Xenex do you have, Mr. CEO?
A fair portion of it. Less than I want.
Are you a billionaire yet?
We're working.
You get these, come on. Are you close or what?
I'm very happy.
Oh, you're very close.
My wife is happy. My parents are happy.
Ah. All right, I'll push no more. Xenex, everyone. Fascinating story.
Thank you very much.
We appreciate it. Good luck.